And welcome to our tutorial. Today we will be teaching you how to perform a motility test. This test involves observing the patient's eyes as they move to follow a pen light in a star or a H pattern to the edge of the binocular field from the primary position. The task of our practitioner, Tina, whether there are any positions of gaze in which a misalignment of the patient's eyes can be observed, or when the patient reports doubling of the target. Now we will start our motility test. Number 1. Keep the room lights on and explain the test to the patient. Here our optometrist tells the patient. This test checks whether all your eye muscles are working well together. Number 2. Ask the patient to remove their spectacles. Stand directly in front of the patient so that both eyes can be seen together. Number 3. Instruct the patient. Please watch my light and follow it with your eyes. Keep your head very still and tell me if the light appears to be doubled, or if your eyes feel uncomfortable at any point during the test. Number 4. Shine the pen light around 40 centimeters in front of the patient and make a H pattern or a star pattern with your pen light. Here, Tina will be demonstrating a H pattern. Move the pen light so that the patient's eyes follow to the edge of the binocular field. Make sure you are able to see the reflexes of both eyes.
1.
Number 5. During the down gaze, hold the patient's eyelid to gain a useful field of view. You may want to switch the pen torch from right hand to left hand at this point. Number 6. Carefully look for any misalignment of the eyes in all positions of gaze. The corneal reflexes can help you with this. Number 7. If the eye movements were smooth and accurate with no double vision, the test is complete and the results can be recorded. Number 8. If the patient reports any problems, then record the position of gaze when the following occur. Diplopia or discomfort, any overreaction or underreaction of the eye, jerky or inaccurate eye movements. If the patient has double vision, establish if it is horizontal, vertical, or diagonally separated. Number 9. Cover each eye in turn to determine which eye is seeing which image. When the eyes are elevated, the eye that sees the higher image is seen by the paretic eye. Red-green goggles or a red filter can help in distinguishing the image.
1.
Number 10. When the eyes are looking down, the eye seeing the lower image is seen by the paretic eye. Similarly, when the eyes are looking right or left, the paretic eye is the eye that sees the image that is further to the right or left, respectively. This is the end of the test. This is the H pattern as demonstrated earlier. Alternatively, this is the star pattern. The practitioner can choose either pattern for their motility test. Now we will demonstrate the most common errors made by practitioners. Number 1. Not using the pen light. This means you can't see corneal reflexes, and it makes it more difficult to determine when the patient's eyes are at the edge of the binocular field. Number 2. Performing the test too quickly or too slowly. Number 3. Not holding the top lid when viewing the eye movements in the down gaze. Number 4. Going too close to the patient. Or being too far away from the